Congratulations, it's time to take your new baby home. We would like to do some discharge teaching to help with any questions that you may have. We will cover information regarding taking care of baby, taking care of mom, and how to get your birth certificate and social security card. While you were at the hospital, there were some routine screenings done for baby. The nurses drew the first genetic and metabolic screening for the state of Colorado, and that was sent to the state lab. This is a 2-part test, so the second part will need to be drawn by your pediatrician. You will be given a lab slip at discharge to take to your pediatrician's office for them to draw. We also drew a bilirubin lab to check baby for jaundice, and we did cardiac testing, which involved an oxygen check on baby's hand and foot. A technician also did a hearing screen. You will be given some items to take home from the hospital. You may take home your extra diapers, wipes, and mom's perineal care items. Please make sure that you leave the hospital baby blankets and t-shirts, as these belong to our laundry service. The hospital pediatrician will give you a discharge form for your baby, and you will bring this to your pediatrician for your first follow-up appointment. You will also receive a souvenir copy of your baby's footprints and their crib card. Watch for your baby's feeding cues. These may include fingers and fists in the mouth and smacking of their lips. Crying is a late sign of hunger. If you can catch baby when they start showing these earlier cues, it may be easier to latch them and have a good feeding. If you are breastfeeding your baby, the goal is to breastfeed every 2 to 3 hours or 8 to 12 times in a 24-hour period. Do not have more than a 5-hour gap between feedings. Do this until your pediatrician tells you that longer gaps between feedings are okay. Remember to offer both breasts and to burp your baby between breasts when switching sides. If you are formula feeding your baby, you should be feeding them every 3 to 4 hours with no more than 1 5-hour gap between feeds. Do this until your pediatrician okays spacing feedings out more. Burp baby partway through taking their bottle and then after. Cluster feeding is when baby suddenly starts eating more frequently in clusters. This is very common on the 2nd and 3rd day of life and often occurs in the evenings and during growth spurts. This cluster feeding can stimulate an increase in your breast milk. Baby should have 3 to 4 wet diapers and at least 1 to 2 stools per day in the first days, whether they are breast milk or formula fed. By day 5 of life, you should be seeing 5 to 8 wet diapers and 3 to 4 stools every 24 hours. Sometimes formula-fed babies do not stool as often. Check in with your pediatrician with any questions or concerns. If the skin in the diaper area appears irritated, try using a barrier cream, but do not use baby powder. If the irritation does not resolve or if it gets worse, check in with your pediatrician right away. Once you are tub bathing your baby, the water temperature should not be above 100 degrees Fahrenheit. If you do not have a thermometer, check the temperature with your elbow or the back of your hand. The water should feel warm, not hot. Remember to never leave your baby alone in the bath or around water. When taking your baby's temperature, follow these simple instructions. Lift your baby's arm and place the smaller end of the thermometer well into their armpit. Lower your baby's arm and hold it close to their body and press the start button. Keep your baby's arm down and the thermometer in place until the thermometer beeps. A temperature above 100.4 degrees Fahrenheit in a newborn is an emergency. Call your pediatrician. Your baby may develop a newborn rash. This is very common and usually appears within the first few days after birth. It consists of multiple red splotches on their body with yellowish white bumps in the center, which come and go in the days after birth and should resolve in about a week or so. No treatment is needed, just time. Please consult your pediatrician for any questions or concerns. Jaundice is caused by a buildup of bilirubin in your baby's system. This buildup can cause a yellow hue on your baby's skin. Bilirubin levels have been monitored here in the hospital and may continue to be monitored by your pediatrician. If necessary, your pediatrician or provider may ask you to supplement with pumped breast milk or formula to hydrate baby so they will pee and poop more efficiently. If you have a little boy, you may have chosen to circumcise him. Your nurse has instructed you on care of the circumcision site. If you have questions or need further instructions, please ask before discharge. Remember to get additional petroleum jelly for circumcision care at home. Sleep safety is very important for your newborn. The American Academy of Pediatrics urges parents to make sure that baby sleeps on a flat, not inclined surface during sleep, and they do not recommend bed sharing. Always put your baby on their back to sleep. Be sure that there is nothing in the crib but a tight-fitting sheet and your baby. It is important that you never shake your baby. Crying is their way of communicating. Know your limits. Put your baby in a safe place and walk away if they are crying inconsolably and you need a break. Babies ages newborn to 1 year, especially during the 2 to 4 month range, are at the greatest risk of injury from shaking. Shaking them can trigger the whiplash effect that can lead to internal injuries, including bleeding in the brain and/or eyes. Knowing when to call the baby's doctor is also important. These few things will help you decide if a call is warranted. If your baby has consistent or inconsolable crying, if they are vomiting or have diarrhea, if they refuse to eat 2 feedings consecutively, if they are unusually sleepy, lethargic, or hard to wake, if they have difficulty breathing, or if their temperature is 97.8 degrees or less or 100.4 degrees Fahrenheit or higher. You may also call your baby's doctor with anything that you are concerned about. Let's move on to taking care of mom. The uterus will begin shrinking back to pre-pregnancy state immediately after birth. Mom may feel some cramping as this process takes place. This is often felt more intensely when baby is nursing. Mom will continue to bleed for several weeks after giving birth. This will taper off in amount and begin to get lighter in color. Call your OB or midwife if mom is passing clots larger than a golf ball, soaking through more than 1 pad in an hour, or has foul-smelling vaginal discharge. You may go home with pain medication. Do not drive while taking narcotics. Acetaminophen and ibuprofen are commonly used pain medications that are non-narcotic and that you can purchase over the counter. Continue to take your stool softener as directed by your provider. Colace is a commonly used over-the-counter stool softener. Medication should be approved by your provider or a lactation consultant if you are breastfeeding. Mom may experience sore nipples as she begins to breastfeed. A good latch with every feeding will be important for both mom's comfort and so that baby is transferring enough breast milk. Symptoms of a clogged milk duct include a small, hard lump that is sore to the touch, a very tender spot in your breast, redness in your breast, or a hot sensation or swelling that may feel better after nursing. These symptoms may be relieved by heat, hand expressing or pumping breast milk, or breastfeeding baby. Feeling achy, run down, and or feverish could be a sign that a clogged duct has become infected and you should see your doctor. Left untreated, a clogged duct can evolve into mastitis, which is an infection of the milk duct, so do not ignore the symptoms. If you have any lactation questions or concerns or need help navigating a breastfeeding issue, please reach out to a lactation consultant. Sometimes your insurance covers some lactation help, so check with them. Also, check your discharge folder for lactation resources that we provide here at the hospital. Other important keys to recovery are drinking plenty of water, which is about 8 to 10 cups per day, continuing to eat a well-rounded diet, and continuing on your prenatal vitamins after delivery while healing and while breastfeeding. You have been instructed to use a lidocaine spray and witch hazel pads to help with discomfort and healing if you had an episiotomy or any vaginal tearing. These can both be bought over the counter. Do not continue using ice packs at home unless you have been instructed to by your OB provider. Any stitches that you do have after a vaginal delivery will dissolve on their own. To reduce urinary stress and incontinence and to strengthen your pelvic floor after childbirth, Kegel exercises can be done. Repeatedly contract and relax the muscles that form part of the pelvic floor. It is recommended that nothing be put in the vagina for 6 weeks after delivery. This includes intercourse and the use of tampons. If you had a C-section, there are a few things that you will need to know. You will typically have a follow-up visit with your healthcare provider at both 2 weeks and 6 weeks postpartum. Watch your incision for signs of infection, which include severe abdominal pain or pain at the incision site that doesn't go away or gets worse, redness, swelling, or foul-smelling discharge from the incision site, a fever higher than 100.4 degrees Fahrenheit, or foul-smelling vaginal discharge. If you have steri strips, they will fall off on their own within the next several days. If you have external stitches, your provider will likely remove them at the 2-week postoperative visit. You may shower. Pat the incision dry after showering. Do not lift anything heavier than baby until returning to your healthcare provider and receiving further clearance from them. Do not drive while taking narcotics. After surgery and even after a vaginal delivery, constipation can be a common complication. There are some things you can do to prevent constipation. Eat plenty of leafy green vegetables and high-fiber foods, as well as iron-rich foods. Drink plenty of fluids, specifically warm or lukewarm fluids, and prune juice can be particularly helpful. Make sure you are moving and walking intermittently throughout the day. This can also help relieve gas and bloating. Make sure you do take some time to rest. And finally, relax. Anxiety can lead to constipation. Make sure you relax and take your time in the bathroom. You have gone through a huge physical and hormonal shift during and after childbirth, and your body will shift from pregnancy hormones to lactation hormones. The postpartum baby blues may occur about 2 to 3 days after childbirth. Some women begin to feel depressed, anxious, and upset. They may feel angry with the new baby, their partners, or their other children. They may also cry for no clear reason, have trouble sleeping, eating, and making choices, or question whether they can handle caring for a baby. Postpartum depression can also affect women after childbirth. Women with postpartum depression may have intense feelings of sadness, anxiety, or despair that prevent them from being able to do their daily tasks. Reach out to your healthcare provider if you feel like you are experiencing these symptoms. If you ever feel like harming yourself or your baby, call 911 immediately. Other reasons to call your provider are severe abdominal cramping, constipation that does not respond to diet changes, pain or burning with urination, drainage around your incision site, a red lump or spot on the back of your leg, a temperature greater than 100.4 degrees Fahrenheit, or anything else that you may be concerned about. Finally, we will talk about how to obtain your Social Security card and birth certificate for your baby. There is an instruction sheet for this process in your discharge folder. The Social Security Administration mails your baby's Social Security card automatically 1 to 2 months after delivery if you selected the box that you did want a Social Security card issued to your baby. If the United States Postal Service is unable to deliver it for any reason, you will need to go request it from the Social Security Administration. The birth certificate is not automatically mailed in Colorado. You do need to request your copy 2 or more weeks after delivery. You can do a walk-in request and pickup at the same time at the Douglas County Health Department. You can call 720-643-2480 to confirm that your birth certificate is ready for pickup if you would like to check on its status before going to the office. If you filled out an acknowledgement of paternity form, the birth certificate can take longer to process, so please do call the number above before going to pick up your birth certificate if you filled out an acknowledgement of parentage form. Please feel free to call our birth concierge with any non-medical questions or concerns that you may have after taking baby home. Any medical questions need to be directed to your OB provider or midwife or pediatrician after delivery. Congratulations! Taking your baby home will be an exciting time in your life. It has been a pleasure here at Advent Health Castle Rock to take care of you.